In this presentation, we will be talking about HIV, AIDS, and illnesses that arise from an immune-compromised body called opportunistic infections. HIV is the starting point of this virus, so we will begin there. HIV. HIV is a human immunodeficiency virus which, if left untreated, can turn into AIDS. There are several ways to transmit the HIV virus. If you come in contact with certain body fluids, you might be in danger of getting HIV. These body fluids include blood, semen, rectal fluids, vaginal fluids, and breast milk. HIV can be transmitted either sexually, if an HIV-infected person shares needles with an HIV-negative person, if a blood donor is HIV positive and their blood is given to an HIV negative person, from mother to child via breast milk, also possibly from mother to child when the child is in the womb. Thankfully, medicine has been able to lower the risks of HIV passing on to the child before they are born. There are two types of HIV, HIV-1 and HIV-2. Both forms attack the immune system, but most patients will have HIV-1. HIV-1 and HIV-2 are genetically distinct, with only a 55% sequence identity to each other. HIV-2, however, has a lower viral load, which we will go over viral load in this presentation, and is less likely to be transmitted compared to HIV-1. HIV-2 also does not respond as well to some medications that are prescribed to patients who have HIV. Patients with HIV-2 also have a longer stage 2 phase than their counterparts of HIV-1. This being said, HIV patients will still go through the 3 stages of HIV if not treated properly. The 3 stages of HIV are acute HIV infection, chronic HIV infection, and acquired immunodeficiency syndrome, AIDS. Here I have the stages that the CDC posted on their website. Stage 1. Acute HIV infection. People have a large amount of HIV in their blood. They are very contagious. Some people have flu-like symptoms. This is the body's natural response to infection. Some people may not feel sick right away or at all. If you have flu-like symptoms and think you may have been exposed to HIV, seek medical care and ask for a test to diagnose acute infection. Only antigen antibody tests or nucleic acid tests, or NATs, can diagnose acute infection. We will go over these tests later in the presentation. Stage 2. Chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active but reproduces at very low levels. People may not have any symptoms or get sick during this phase. Without taking HIV medicine, this period may last a decade or longer, but some may progress faster. People can still transmit HIV in this phase, especially if they are not taking medication. At the end of this phase, the amount of HIV in the blood, called viral load, goes up and the CD4 cell count goes down. The person may have symptoms as the virus levels increase in the body and the person moves into stage 3. It should be noted, people who take HIV medicine as prescribed may never move into stage 3. Stage 3. Acquired immunodeficiency syndrome, AIDS. The most severe phase of HIV infection. People with AIDS have such badly damaged immune systems that they get an increasing number of severe illnesses called opportunistic infections. People receive an AIDS diagnosis when their CD4 cell count drops below 200 cells, or if they develop certain opportunistic infections. People with AIDS can have a high viral load and be very infectious. Without treatment, people with AIDS typically survive about 3 years. So what is the genetic makeup of HIV? In this photo, we see glycoproteins, the viral envelope, a matrix, and a capsid. Inside the capsid are RNA strands and the enzymes integrase, reverse transcriptase, and protease. HIV is spherical. The outside shell, the envelope, is covered in glycoproteins. GP120 and GP41 attach itself to the host cells. The GP120 glycoprotein will attach itself to CD4 cells. CD4 cells are white blood cells that help fight infection. The GP120 glycoprotein will attach to the protein on top of the CD4 receptor called CC chemokine receptor 5, also called CCR5. Once the virus is attached, the GP41 glycoprotein will fuse the virus envelope with the cell wall, allowing the HIV virus to insert the capsid to begin the viral takeover. HIV is a retrovirus. A retrovirus is any group of RNA viruses which insert a DNA copy of their genome into the host cell in order to replicate. Now, what does this mean? Since HIV does not have DNA, it will use RNA and the reverse transcriptase enzyme to create proviral DNA. Once there is proviral DNA, the enzyme integrase will attach itself to the end of the DNA copy and enter the cell nucleus to connect the copy to the cell's actual DNA. The virus will go into a latency period, staying dormant until given a signal to become active. It should be noted that it is difficult to detect HIV when the virus is in this latency period. Once the virus becomes active, it will begin creating messenger RNA, which give instructions to create viral proteins. The viral proteins will be broken up by the enzyme protease, and the proteins will begin to assemble at the cell wall, budding out and creating an envelope with the infected cell's membrane. With the HIV virus replicating, the CD4 count will begin to drop, which, if left untreated, can bring the CD4 count so low that the patient can be classified as having AIDS. It is important to get tested, especially if you begin to show symptoms and suspect you may have the virus. What are the symptoms of HIV? For stage 1 of HIV, the symptoms are usually the following: fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. As stated earlier in this presentation, the patient will show flu-like symptoms, which is normal when the body detects an infection. I also said usually because some people do not always show symptoms in stage 1. In stage 2, there might not be any symptoms. This stage is called the asymptomatic stage. This is where the virus is still replicating, but at lower levels. The infected person appears fine, and if the infected person takes their medicine, they can bring down their viral load to being undetectable. If the viral load is undetectable, then the patient is less likely to transmit the disease to anyone else. With that being said, transmission is still possible, and the patient should always check their viral load for themselves and those they are with. What if the patient never seeks treatment? Stage 3. The AIDS symptoms are rapid weight loss, recurring fever or profuse night sweats, extreme or unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurologic disorders. To determine if you have HIV, you can take one of the following tests. Antigen antibody tests. This test is done by drawing blood from a vein. Antigens are substances on the HIV virus itself and are usually detectable in the blood within a few weeks after exposure to HIV. Antibodies are produced by your immune system when it's exposed to HIV. The combination antigen antibody test can take 2 to 6 weeks after exposure to become positive. The antibody tests. This test looks for antibodies to HIV in the blood or saliva. Most rapid HIV tests, including self-tests done at home, are antibody tests. Antibody tests can take 3 to 12 weeks after exposure to become positive. Nucleic acid tests, or NATs. This test looks for the actual virus in your blood, checking to see the viral load. This involves blood drawn from a vein. If you have been exposed to HIV within the past few weeks, your doctor may recommend NATs. If you are positive and the doctor wants to see what stage you are in, we can do the following tests. The CD4 T cell count. CD4 T cells are white blood cells that are specifically targeted and destroyed by HIV, as we've mentioned before. Even if you have no symptoms, HIV infection progresses to AIDS when your CD4 T cell count drops below 200. The viral load HIV RNA. This test measures the amount of virus in your blood. After starting HIV treatment, the goal is to have an undetectable viral load. This significantly reduces your chances of opportunistic infection and other HIV-related complications. Drug resistance. Some strains of HIV are resistant to medication. This test helps your doctor determine if your specific form of the virus has resistance and guides treatment decisions. Let's say you have just received a positive test for HIV. What are the treatment options? Patients will be given treatment with a combination of HIV medicines, a practice called antiretroviral therapy, or ART. Patients who find out they are HIV positive will begin ART immediately, usually given 3 HIV medicines from at least 2 different HIV drug classes. What are the drug classes? Nucleoside reverse transcriptase inhibitors, NRTIs. NRTIs block reverse transcriptase, not allowing the virus to create proviral DNA. This stops replication, not allowing the virus to spread and take over more CD4 cells. Non-nucleoside reverse transcriptase inhibitors, NNRTIs. NNRTIs will bind to and alter reverse transcriptase, not allowing the enzyme to fully convert its RNA strand to proviral DNA. It should be noted that HIV-2 is more resistant to NNRTIs and should not be a part of a patient's ART if they have HIV-2. Protease inhibitors, PIs. PIs block protease from breaking up the HIV proteins, not allowing the proteins to form in their needed fashion to leave the host to infect more cells. Fusion inhibitors. Fusion inhibitors bind to the envelope protein and block the changes needed for the virus to fuse with the CD4 host. It should be noted that HIV-2 is also resistant to this medicine, so another class of drugs should be used for the patient's ART. CCR5 antagonists. CCR5 antagonists block the CCR5 coreceptors of certain immune cells, not allowing the GP120 protein to bind to the CD4 cell. Integrase strand transfer inhibitor, INSTIs. INSTIs block the integrase from inserting the proviral DNA into the actual DNA of the host cell. This stops the process right before messenger RNA can be sent out to create viral proteins. Attachment inhibitors. Attachment inhibitors bind to the GP120 protein, preventing the glycoprotein from binding to the CD4 cells. Post-attachment inhibitors. Post-attachment inhibitors block CD4 receptors on the surface of certain immune cells, not letting the virus attach to a host. Pharmacokinetic enhancers. This medicine does not have any effect on the virus directly. Instead, it enhances the effectiveness of the other medicines that the patient would have to take to combat the virus. What if the patient does not want to take the medicine? What if the patient allows themselves to get to stage 3 where AIDS is now in full effect? This is where opportunistic infections thrive. What are opportunistic infections? OIs are infections that are more frequent or more severe in people with weakened immune systems. With the CD4 cells low, the compromised immune system is not able to fight off diseases like a healthy immune system. So what are some common OIs associated with AIDS? Candidiasis. Candidiasis is one of the most common infections and is also used as an early indicator of AIDS when the patient shows signs of oral esophageal candidiasis. This infection comes from the fungus Candida albicans, which usually does not cause any issues for individuals who have healthy immune systems. For patients with compromised immune systems, the fungus turns pathogenic, leaving white patches on the tongue, cheeks, and throat as shown in these photos. Kaposi sarcoma. KS is considered to be the defining illness that a patient officially has AIDS. The underlying cause for Kaposi sarcoma is the human herpes virus 8, also called HHV8. When a person's immune system is healthy, this virus is kept under control. If a patient is taking immune-suppressing drugs or has an immune deficiency, HHV8 can grow and trigger KS. Symptoms of KS are slightly elevated purple, pink, brown, black, blue, or red blotches or bumps anywhere on the skin or in the mouth and/or throat. Lymphedema, which is swelling caused by a blockage of the lymphatic system. Unexplained cough or chest pain. Unexplained stomach or intestinal pain. Here is a photo showing some of the blotches and bumps. This photo is mild compared to other photos I have come across, but it still shows how serious KS is and why HIV patients should always follow through with ART. Progressive multifocal leukoencephalopathy. As you can see from this photo, the disease is almost exclusively found in patients who have HIV. This infection is caused by John Cunningham virus, which is a polyomavirus preying on weakened immune systems. A polyomavirus is a non-enveloped double-stranded DNA virus that is common in mammals and birds. The JC virus is a demyelinating disease which attacks the central nervous system. The symptoms for this disease are clumsiness or loss of coordination, difficulty walking, facial drooping, loss of vision, personality changes, trouble speaking, and weak muscles. Pneumocystis pneumonia. PCP is caused by the fungus Pneumocystis jirovecii. in the movie and the band played on, the diagnosis for one AIDS patient before you knew it was AIDS was PCP. The doctor could not understand or believe it since PCP is only in patients with weakened immune systems. This fungus is very common, and most people's immune systems have come across this fungus and have beaten it by the time they are 4 years old. However, when the immune system is compromised, the fungus is able to attack the fibrous tissue in the lungs. Symptoms of PCP are fever, cough, difficulty breathing, chest pain, chills, and fatigue. It should be noted that there are many types of pneumonia and AIDS patients are vulnerable to all of them. PCP is just the one that is most common in AIDS patients. Tuberculosis, TB. TB is caused by the bacterium Mycobacterium tuberculosis. Tuberculosis spreads through the air when an infected person coughs, sneezes, or speaks. While TB is known for attacking the lungs, TB can attack any part of the body including the kidney, spine, and brain. TB has two stages, latent TB infection and TB disease. Patient with AIDS will have TB develop to the second stage disease, which can be fatal if not treated. These symptoms are a cough that lasts more than 3 weeks, loss of appetite and unintentional weight loss, fever, chills, and night sweats. There are many others, but I will end with OIs and close out my presentation. HIV is a human immunodeficiency virus with 2 types that affect humans. There are 3 stages, the third stage being AIDS. Medicine can keep stage 3 at bay, even making the viral load in the blood undetectable. Antiretroviral therapy, or ART, is usually 3 medicines from 2 different drug classes and can keep HIV patients healthy. If a patient reaches the stage of AIDS, there are a plethora of opportunistic infections that are waiting to take advantage. Please be safe, be healthy, and get checked when necessary. Thank you.